The intersection of cellular senescence and sports medicine is an emerging frontier with significant therapeutic potential. Traditionally, sports injuries, especially overuse injuries like tendinopathies, cartilage wear, or repetitive strain, have been treated through rest, physical therapy, anti-inflammatory drugs, or, in some cases, surgery. But a growing body of research suggests that one of the hidden players in delayed healing and chronic inflammation may be senescent cells, which accumulate not only with age but also in response to cellular stress, mechanical damage, and repeated tissue strain. This opens an exciting possibility. Could senolytic therapies help accelerate recovery in injured athletes or active older adults by clearing out these dysfunctional cells? Senescence is a cellular stress response that permanently halts cell division and shifts the cell into a pro-inflammatory state. While initially protective, preventing the proliferation of damaged or precancerous cells, senescent cells can become problematic when they persist in tissues and secrete the senescence-associated secretory phenotype, SESP. The SESP includes inflammatory cytokines, proteases, and growth modulators that can degrade extracellular matrix, impair stem cell function, and perpetuate tissue damage. In the context of sports injuries, this response could be a key reason why tendons remain painful, cartilage fails to regenerate, or muscle injuries lead to fibrosis rather than full repair. In younger, healthy individuals, immune surveillance typically clears senescent cells after an injury. But in older adults, or in athletes who undergo repeated microtrauma without sufficient recovery, senescent cells may accumulate and interfere with the regeneration process. Studies in animal models have shown that senescence markers rise in joint cartilage, ligaments, and tendons following injury, and that this buildup correlates with impaired healing and structural weakness. Even muscle tissue, long thought to be highly regenerative, can harbor senescent satellite cells that reduce the effectiveness of repair following repetitive strain or trauma. Here's where senolytics offer a unique angle. By selectively clearing these non-dividing, inflammatory cells, senolytics may reset the local tissue environment, allowing more effective repair and reducing chronic inflammation. In mouse models, senolytic treatment following joint injury has reduced cartilage loss and improved mobility. In muscle injury studies, the removal of senescent cells has enhanced regeneration and strength recovery. These findings suggest that senolytics might not just treat age-related degeneration, they could actively assist in tissue recovery, especially where injury has overwhelmed the body's natural repair systems. For athletes, this has clear implications. Consider a runner with chronic Achilles tendinopathy or an older tennis player with shoulder impingement and delayed recovery. These tissues often show signs of collagen disorganization, persistent inflammation, and poor healing despite rest and rehab. If senescent cells are part of the problem, either from aging or repeated microtrauma, then a short course of senolytic therapy could enhance responsiveness to physiotherapy, reduce pain, and speed up recovery timelines. Even younger athletes with intense training loads might benefit during periods of high stress or recovery from injury. There are also broader benefits. Senescent cells can interfere with stem cell activity, and clearing them has been shown to rejuvenate local progenitor cell niches. In joint cartilage, for instance, senolytic treatment has restored the chondrogenic capacity of remaining stem-like cells. In muscle, it can enhance the proliferative ability of satellite cells needed for muscle fiber repair. This rejuvenating effect could mean that injured tissues don't just heal faster, they heal better, with restored structural integrity and reduced risk of re-injury. However, some caution is warranted. Most senolytics studied in depth, such as dasatinib, navitoclax, or UBX compounds, have their roots in oncology and require careful dosing to avoid off-target effects. That said, more natural senolytics such as Physidin and Quercetin have shown excellent safety profiles in both preclinical and early clinical studies and could be promising candidates for intermittent use in active individuals. Unlike NSAIDs or corticosteroids, which broadly suppress inflammation, senolytics target the source of chronic inflammation at the cellular level, potentially offering longer-lasting and more tissue-specific benefits. Timing will also matter. The inflammatory response to acute injury is part of normal healing, and clearing senescent cells too early could disrupt beneficial immune signals. But in cases where healing has stalled, or where pain and dysfunction persist beyond the expected timeline, senolytics might play a reparative role. Intermittent therapy, perhaps a few days of treatment every several weeks, could provide the benefits without interfering with acute phase responses. As research expands, It's likely that senolytics will become part of a more integrated sports recovery protocol, used alongside rehab, regenerative therapies like PRP or stem cell injections, and advanced imaging to monitor tissue quality. For aging athletes or fitness enthusiasts with stubborn injuries, senolytics could mean not just faster healing, but restored function and the ability to stay active longer without succumbing to chronic pain or degeneration. In the near future, we may see personalized protocols in sports medicine where senescence biomarkers guide the use of senolytics, choosing when and where to intervene based on tissue stress, age, and injury type. As we better understand how senescence contributes to soft tissue injury, this class of drugs could represent a paradigm shift in recovery, addressing the cellular barriers to healing rather than just managing symptoms. For active individuals trying to preserve performance and mobility deep into midlife and beyond, that shift could make all the difference.